Virginia nursing homes are not homes. They are human landfills where the elderly are dumped, forgotten, and left to rot under the indifferent gaze of broken system.
On the third convening of Virginia's Nursing Home Oversight and Accountability Advisory Board, stakeholders heard passionate feedback from the public.
The agencies need to be held just as accountable as the nursing homes.
And delivered their own testimonies as they urgently work to fix the Commonwealth's long-term care system at the direction of Governor Glenn Youngkin's executive order.
We face a crisis.
Board member Joanna Heiskell, a consumer advocate who says her mother was neglected in a facility, implored the body to address what she believes is the root cause of declining quality care: profit-seeking.
To allow corporations to purchase and operate these homes as profit-driven enterprises is wrong. Because what happens is that you have profit over quality of health.
And she asked that they center solutions on resident experiences.
Think of the lonely person in a bed somewhere that's laying in their waste and that's not getting their bell answered, that's crying like my mother did.
Henrico's fire chief, Jackson Baynard, educated folks on how facilities drain emergency resources on unnecessary calls for service that he says stem from lacking care and inadequate staffing.
We'll get a 911 call for a catheter that has come out. That's something that can be very easily, with appropriate staffing, fixed within that facility.
And Jonathan Cook, the CEO of some not-for-profit senior communities, acknowledged the dedication of frontline healthcare workers, but said he was unaware that the state ranked so low for quality of care in nursing homes before serving on this committee.
You know, I didn't know until I came here that Virginia ranked 38th in the country. That was eye-opening to me. I went home and told my wife. I said, wow.
And during a discussion about staffing mandates, he noted that providers are struggling to recruit employees.
I'm in the process of importing RNs from the Philippines just because we can't find them here.
No,
so you can't just say arbitrarily that you're going to hire more people. There are.
not saying that.
You are. You've said it 6 times.
At one point, the board broke off into 3 subgroups to think about preliminary policy recommendations that are due to the governor next month. Here's what they came up with. First, they want to propose stronger ownership transparency requirements and cost reporting procedures to respond to private equity acquisitions. That includes giving the health department the authority to stop owners with a poor quality history from purchasing more facilities.
We've heard a lot throughout the work stream and throughout some of our meetings about really poor performance from a number of facilities that may all be affiliated with one another.
Next, they want to provide more accurate public-facing consumer information, expand workforce capacity, and strengthen cross-agency collaborations within the government. And lastly, they're pitching fully funding the Long-Term Care Ombudsman's program, a residents' rights campaign, and regulations that would require hospitals to give patients information on quality data before discharging them to a nursing home.
And it was acknowledged that, these hospital systems sometimes have partnerships and contracts with pipelines that feed these patients to these nursing homes. And they think it should be very much fair, square, based on quality, based on first choice if able.
As far as the next steps, the board will put together their preliminary recommendations into a full report. That report will then go for public comment and then eventually make its way to the governor by the end of the year. In Henrico County, I'm Tyler Lane for CBS 6 News.